Yeah, Namaskar. Good evening. I'm Dr. Bishnu Panigrahi from Fortis Healthcare, and welcoming everyone live on the Facebook Live for the new kid in the block, the HMPV that we keep hearing about, the human metapneumovirus that has caught the world by storm. And it's exactly 5 years back that something similar happened in China, and then the once in a century pandemic struck globally. All of us suffered. That was in 2000, exactly 5 years back. It was this time of the year. And although we know that this virus was first isolated in sometime around in 2001, but with the huge amount of media hype about what's happening in China, we thought that it will be in good taste to have some of our senior clinicians to speak about it, to share their thoughts about it, the do's and don'ts. And first of all, we don't want to press the panic button here. It is nothing to panic about, but obviously, being prepared is a better way to face it. So, with that, I'd like to open this discussion on this new virus that is caught the imagination of the world on what to do, what not to do. And with that, I'd like to say that we have doctors from across our network of hospitals. What is very fortunate to have very skilled senior clinicians to help us take the healthcare forward. And with that, we'll like to start that. We have Dr. Shushmita Chaudhary from Kolkata, senior pulmonologist. We have Dr. Rahul Nagpal, our senior pediatrician from Delhi. We have Dr. Harinder Singh. He's the latest hospital of Fortis Healthcare in Manesar, the new Gurugram that we call about. He's the head of internal medicine there. We have Dr. Anita, who's from Mulund, the Fortis flagship in Mumbai. So with that, would like to start the discussion with Dr. Shushmita. First of all, you have to open the batting today. Is that what is HMPV and why is it in the news?
So basically, sir, this is not really a new virus, but I think it happened in a lot of numbers in China, and they recognized that suddenly there were too many people, especially really young children, that were suffering, and that's how it came in the news because it's a virus which is not new. It has been around at least that we know since 2001, but it's highly contagious. So it is again because it's a highly contagious virus, not just by airborne, but also through fomites, which basically means clothes, food items, or utensils that are very closely associated with the affected individual. It can spread from one person to the other. Not that it as deadly as COVID was, as we all saw. This usually presents as respiratory tract infections, just like any other influenza illness, and in most cases causes mostly upper respiratory tract infection like sneezing, sniffles, headaches, a bit of chills, sometimes rashes and fever, and a bit of sore throat. In
You've gone into mute, Shushmita. Okay, there's some connection issues. We'll get back to Dr. Shushmita again. I'd like next to from east to go to west. Dr. Anita is there. So, Dr. Anita, what are the signs and symptoms of this new virus that has caught the imagination of the Indian and global public?
Um, Hello. Like Dr. Sushmita said, the most common symptoms that you tend to see in adults would be similar to what you would see even in the pediatric age group, which would be like any other common cold. So it will present with a sore throat, runny nose, rashes, which could be low grade to high grade, depending upon it. Generally, high grade fevers are more seen in children as compared to in adults. In adults, it may be a low grade temperature and body aches and pains. A typical flu kind of a symptom. It belongs to the same family as the other common cold virus called as an RSV. So it has similar kind of symptoms. The major symptoms that you might be seeing in very less number of patients would be in the form of lower respiratory tract symptoms, which would be basically more severe cough, breathlessness, which could indicate that there could be an evidence of a pneumonia in the background. Other than that, it's like any other common cold virus.
Okay, thank you.
Yes, sir.
Now moving to, because this is known that it affects children in a substantial manner. So I'm coming to Dr. Rahul Nagpal, our pediatrician. So Dr. Rahul, who's at risk and why are children a vulnerable category? And I have another question on this also. Is that it's important that what should be the advice to parents of children, because a lot of times we know that there's over the counter medications we go and take. So adults and children are different. So before any medications are given to kids, uh, one of the advices that are there, that should they be consulting the pediatrician before they take any medicines? Over to you.
So, as all our panelists have mentioned, the usual symptoms, both in adults and children, children are particularly vulnerable because of their immature immunology or immature immune system. They are naive to many of the viral illnesses, not only HMPV, and they get these kind of infections much more common, especially before 5 to 6 years of age. Other vulnerable people of the society are elderly above 65 years of age, those who have underlying medical illnesses. And let me also put it this way, that vulnerable children also have a category. Not all children, but children who are born premature or who have underlying respiratory diseases or underlying immune deficiency states. They are the ones who get into a severe state. And it must be noted that HMPV will, even in children, the admission rate is hardly 1 to 2%. And that is because, and that is also in those children who are immunocompromised. So that is one part. And needless to say that children are vulnerable. However, the disease is essentially mild. Having said all that, what should we tell the parents? The first thing is that, and particularly the parents, is please do not panic. We know this virus. We didn't know the COVID virus, but we know this virus. We know how it behaves. And the treatment is largely supportive and symptomatic. Like all medications, we tell the parents, please don't start medicines on your own. On the counter sale medicines like paracetamol, etc., are perhaps admissible. Children with mild viral illnesses and particularly HMPV, because we are discussing that, should stay home. Respiratory etiquettes must be taught to our children: when they sneeze, when they cough, how to cover their mouth, and how to use tissues. In crowded environment, they must wear masks, and where the ventilation is poor, they should be taught how to wear masks and take care of that, particularly in children above 3 to 4 years of age. Having said that, we should, without panic, be wary of all viral illnesses, particularly in children. And there are certain red flags or danger signals which all parents should know. And that is when the child must see a doctor or their pediatrician. The red signals are, obvious red signals are breathing difficulty, vomiting, in children, fast respiration, because fast respiration is very easily seen in children. High grade fever for more than 2 to 3 days, not accepting food at all, not passing urine for more than 6 to 10 hours. All these symptoms are red signals in any respiratory illnesses, particularly in HMPV2. So these are the red signals, and these are the danger signs where we must teach our parents. So that is what I would say.
Thank you. Uh, Dr. Hatinder, Are you there? I think this again some connection issue. I'll come back to him later. So Dr. Sushmita, coming to you is that what are the preventive measures which are most important for individuals with pre-existing respiratory conditions?
Yeah, that's a very important question because most of the patients that we face in our outpatient departments have pre-existing respiratory conditions. So first and foremost, as far as HMPV is concerned, you don't have any specific or separate vaccine for it. But if you do have airways disease like asthma or COPD or interstitial lung disease, these can get worsened by any viral infection. So, and lots of times, viruses can coexist in the same patient. They can have co infection with other viruses. So, if you haven't taken, then definitely take your influenza vaccination every time when it is due, and a pneumonia vaccination as per as your doctor's advice. And make sure that your inhalers are taken properly, your underlying disease is controlled very well. And especially during winters when the viral load as per se is very high, whenever you're going out or you're going for a walk, avoid walks early in the morning or after dusk, because that's when the smog levels in the cities come down quite a lot, and that can contribute to symptoms. Also, avoid gatherings. If you have to go, then please make sure that you're wearing at least a blue mask, and avoid people who are coughing, sneezing, etc. If somebody, especially a child in the house, has developed viral symptoms, because they very commonly bring back from school, you wouldn't really know which virus has affected them. So isolate the child, or you stay away from the child at least for the first 5 days of the viral illness. And if you are yourself affected, drink plenty of fluids, take your inhalers, and if any of your symptoms are worsening or exacerbating, see your doctor early rather than late. That's the advice I would give people with pre existing illnesses.
Thank you. Dr. Hadinder, coming to you from New Gurugram, our new hospital of Fortis Healthcare. So, what are the causes and preventive actions one should follow in general? Because it's important to pass on the message to the public also.
So, as discussed by the panelist earlier, also the it can affect population of any age group, but the vulnerable population is, as we know, that less than 5 years of age children, and elderly of more than 65 years of age, and adult population who has comorbidities like diabetes, the malignancies, COPD, bronchial asthma, patients who have cardiac illnesses, patients who are taking corticosteroids. And on top of that, pollution is also one of the major contributory factor for worsening of the symptoms. And the preventive actions, they should stay in a well ventilated home or house or room, and hand hygiene, isolation, avoid going to the gatherings, wear mask, and if they are a smoker, then please stop smoking, drink adequate liquids, and remain rehydrated. And if symptomatic, you should visit your healthcare provider as early as possible.
Okay. Thank you. Dr. Anita,
Yes, sir.
coming to you is that what are the general do's and don'ts for adults to prevent this infection to happen?
Uh, I think most of them have already spoken in one way or the other about the do's and don'ts. Coming to the, let's say, looking at the do's, we need to keep our hands clean. So we need to sanitize it if you are there in the hospital. If you are at home, then simple soap and water would be good enough to kind of keep it clean. Cover your nose and mouth whenever you sneeze. So cough etiquettes are important here again. Wearing a mask, at least when you're in the hospital or in a gathering, would be something that would be imperative, that is considered as a norm. Avoid touching the face, eyes, nose frequently. That itself will reduce the risk of infection. Sanitizing the area is particularly not required, but cleaning that area on a daily basis, if you have had patients of cold cough coming in, or in the community, if you have people who are unwell in your household, then cleaning that particular area where there would be an higher burden of infection, like the door knobs and the tables would be kind of important. Do not self-medicate. So this is a viral infection. Taking an antibiotic as per the previous prescription of your doctor wouldn't really help. So do not take antibiotics. Do not take antivirals unnecessarily. Otherwise, that's something that is very common in our country. Second would be do not use aspirins in children less than 16, 18 years of age for body aches and fever. Use that only if the doctor has prescribed a particular medication is to be used. Um, do not smoke, do not vape. uh, I think this would in general be good enough. And if you're like Dr. Sushmita mentioned, if you are someone who's an asthmatic or a COPD, do get yourself vaccinated for the other vaccines which are available for prevention of infections other than human metapneumovirus. So reducing the burden of infection of other illnesses also will preferentially help us in managing these patients better.
Thank you. Since the literature keeps saying that the significant population who gets affected are the children, coming back to Dr. Rahul, is that so what is the precautions and that we should convey to the parents to protect their children, especially those who are going to schools and to daycare centers?
So you're muted.
Thank you.
Yeah.
So it should be informed that if there are minor viral illnesses or coughs and colds, please keep them home, especially at the time when there are suspected outbreaks. Second, in the school itself, the cleaning of the desk tabletops must be kept as a priority, and most of the schools are doing that now, especially after learning from COVID. Third, that parents have to be told, yes, it is a viral disease. However, we know about it, nothing to panic, and no panic and no self medication should be done. There are umpteenth number of times, and Dr. Anita just mentioned that antibiotics of the previous prescription should not be taken. But we always find that one cough, one cold, one day of fever, and children will have some kind of antibiotic or something which their doctor had prescribed much earlier. So self medication is very bad. Nutrition is very important in children, and hydration is again a very important thing. I always say to my children when they say, please build up the immunity of our children, I always say it is fresh air, lot of good water, lot of fresh food, and lots of love. We can give everything else, but fresh air perhaps is the problem. However, having said that, as everybody mentioned, that not to go to um, ill ventilated areas to avoid crowding, etc. Hand hygiene, washing of the hands is the single most important thing to prevent the spread. And children should be taught how to wash their hands with soap and water. I'm particularly not a fan of sanitizers to be used in children. They have their own issues. So I discourage unless it is indicated or unless there's nothing else available, no water, no soap. So that's what I would do.
Thank you, Dr. Rahul. I think so that air part was very pertinent, especially now with Delhi going to the elections, because
Yes.
that's engaging everyone's attention. All the Delhi citizens are concerned about the air quality and all that. So I think so very well said. Uh, and now, Dr. Hatinder, coming to is that all of us are aware that there are three segments which are most affected. One is the young children, people above 65 years, and those with weakened immunity. These are the ones that are the highest risk. So, in your opinion, what are the things that what are the individuals that with who have chronic illnesses like diabetes, malignancies, heart diseases, who are having high blood pressure? What how do you protect themselves from these severe complications? If because these are the ones who are more likely to get into complications. So, what are the things that you should advise the patients and the public at large to do?
So first and foremost thing is the adequate control of the underlying disease. like if the patient is diabetic, he should take a good amount of, he should take a balanced diet, he should take a medications and exercise also, so that the blood sugars are well under control. If you're a cardiac patient, then he should take the cardiac medicines, religiously, so that the things should be controlled. And they should visit their doctor regularly, so that the underlying diseases which are there already there, they should be very well controlled. And second is nutritional food, and third is exercise. Exercise is very important. Since we stay in NCR, it's there's a major problem of pollution, but they should do some exercise. If they are not able to go outside, then they should do some exercises at home, maybe yoga, maybe some other exercise, but they should do exercise. And good hydration, they should remain themselves hydrated. And as discussed earlier also, that they should not have a smoking. If they are smoking, then they should stop smoking. And adult vaccination, yes, it is one of the major, factor which will help the patients in reducing not only the symptoms, as well as it will also help in reducing the hospitalizations also. So for that, they should take flu vaccine yearly, and pneumonia vaccines as advised by the physician or by their doctor.
Okay, thank you. So we're just coming to the end of our session. So I'd like to just put it across. This is the open question, and if you could just summarize what are the things that you all feel we should tell the public at large in your just a one line or two line sentence. So to capture this session, I would start off with the ladies first. Purab ya Paschim.
Okay. So I think most importantly, do not panic. After COVID, people are scared of everything, but please don't panic. The human metapneumovirus is just like any other viral infection, and the do's and don'ts of any viral infection during season has to be carried out here as well. So hand hygiene, keep yourself hydrated, and correct your underlying illnesses if you have any. And if you get affected, then make sure you wear the mask for the first 5 days so that you don't spread it around. And isolate a child if they are affected. Eat healthy, and if your symptoms worsen, see your healthcare providers early rather than late. But most importantly, don't panic.
Dr. Anita.
Yes, sir. So I will also say don't panic. That's something that is important to understand, that not all viral infections lead to death. Not all viral infections will lead you to the ICU. So most of these patients of human metapneumovirus will stay at home and get better at home itself. They generally do not need hospitalization. And more importantly, this is not a new virus. It has been in the community for a very, very long period of time. We all have dealt with these viruses time and again in our practices in the past as well, and the patients have not done any worse. So do not believe in all the newses that really come out in the papers. Do understand that it is a virus which can be easily tackled.
Thank you. Dr. Hatinder.
So since this virus has come from the east, so HMPV has gained more air or respect than it deserved, sir.
Okay. Dr. Rahul.
I wish there was a pill known as chill pill. I would have given it to all the parents. They are bombarding me with so many questions. I would just say take a chill pill. Well, I think Dr. Sushmita and Dr. Anita have summarized it beautifully. Don't worry, relax. We are on top of it.
So I'd like to thank all the panelists today, and I think so it was a very informative session. And from Fortis Healthcare, we just want to just convey this to the public at large that, as Dr. Akmal rightly mentioned, chill pill, don't panic. It's a mild illness, and don't rush to the hospital, because what we are seeing in China is that there's a huge surge going to the hospitals rather than consulting your local practitioner, which is important. And it's a mild illness, And as the precautions that have been outlined, please follow, adhere to that, and wishing you that you stay healthy. And all that thing that has been told, we'll be summarizing it in a link and we'll be sharing it across. So please share this. Those who have seen this broadcast, they can share it with their near and dear ones. And the most important thing is that you don't want to press the panic button. Just stay calm and stay safe. Thank you. Namaskar.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.